So we don't know all the answers yet on what causes Parkinson's disease. Probably 10 to 15% of cases may be genetically related. We have identified some of those genes, but that leaves the other 85% that we don't have a genetic basis. So there have been some environmental causes that have been implicated and studied, and nothing has been definitive yet. It seems to be more of a combination of things working together that cause Parkinson's disease to happen. Each of us has a population of cells deep in our brain in the substantia nigra. We're all born with 400,000 cells, 200,000 on each side, and as we age, we lose those, probably 1,000 per year. But something causes those cells to get lost faster in patients that develop Parkinson's disease. Those cells, the purpose is to produce the dopamine that helps these movement circuits in the brain. So when the cells are lost, the dopamine levels decline, and once you reach a threshold, you develop the symptoms. So it's actually a long history of decline before you ever can diagnose the disorder.
What does your work involve?
So movement disorders are treated by medical therapies, which I can address, by surgical therapies, which would be addressed by a neurosurgeon, preferably fellowship trained in those treatments, and then all movement disorder patients can benefit from things such as rehab therapies. I brought along some fun things, but basically these are used for general neurology more than movement disorders. These are to check for reflexes, and this is to check for sensation by feeling for vibration. However, in movement disorders, there are no laboratory tests or radiological tests to make the diagnosis. Instead, it takes an experienced clinician to do a detailed exam of the patient, just by looking at the patient, moving the patient, and such, to be able to identify what movement disorder syndrome they have. So actually, with essential tremor, we'll talk about that one next. Essential tremor has been thought for years to be predominantly genetically based, so it runs in families, but it's thought to be strictly a tremor. However, now research is showing that it is not just a tremor, but that other things are associated with it. Say cognitive changes, changes in thinking, mood changes, gait changes. So research can help us to be better clinicians again by showing us what is involved in the syndrome and allowing us to go to the patient and say, do you have this? Do you have that? How can we treat it? And so you can address the whole patient.